The Orthopedic Specialty Center here takes patients who have mostly had hip and knee replacements. We take them after they have their surgery for approximately 3 days. When we're working with physical therapy, pain management, 3 days of antibiotics, and do an evaluation to get them ready to go home or to a center for further rehab. The day of your surgery, there is not much going on. It's very much a recovery period, a recuperative period. But beginning the next morning is when physical therapy comes, gets people out of bed. We start with the exercises and getting people back on their feet. The third day after the surgery, by that time we have already had discharge planners come in and arrange for delivery of equipment to the house, arrange for home health nurses to come by and monitor the patient. They've already arranged for the physical therapist to come by the house and keep working with the patient. So by the third day, we expect most of the patient's bodily functions and systems to return to normal. We expect by that day also we have arrived at a good system of pain management so that they can start resuming their normal activities within limits and get their exercises done and do their physical therapy and know what they need in the way of prescriptions when the doctor is ready to send them home. We teach a lot about the physical therapy. The physical therapists teach them how to get up out of bed, how to get on their feet, how to safely get across a room and then back into a chair. The physical therapists bring the patients out into our orthopedic physical therapy room, which is a large room where they do additional exercises. They can work with several people at once. They have a stair mock-up where they actually work with people on stairs so that they can get into their house or navigate stairs once they get home. The unit here is in sort of a circle, so the physical therapists work in the way of laps going around the unit, which is, you get competitive races with the patients sometimes. All of the nurses on our floor are trained in orthopedic care, following the surgery and getting people through the rehab process. In that regard, everyone is very accustomed to the orthopedic patient. Our population is, for the most part, only orthopedic patients. We don't mix the population with sick people, people with other processes or infections. And that's one of our focuses, is our patients, in fact, aren't sick. They're not in the hospital or here because they're sick. They've just had a knee replacement or a hip replacement. We're going to get them up and get them moving. We have large private rooms here on this floor, and all the patients appreciate a large private room. In each room we have the patient's bed, we have a large recliner, a couple chairs for visitors, of course the TV, the bed has full controls on it. That's a great thing about our facility, is just the space that the patient feels that they have in the rooms. We're fairly unique in that we're a smaller unit. It's very personal care. We're very focused on our patients here. We get a lot of repeat patients. We know our doctors very well because we are, again, such a small unit. A very cohesive team of nurses and therapists and doctors here.